For months, students have been living at a distance and steering clear of crowds to avoid catching COVID-19.
We've seen a great need for early intervention.
But the sudden shift in behavior seems to be causing another crisis.
We know that substance use is on the rise. And I think for those of us that work in the field, I think we need to prepare ourselves.
Colleen O'Neill, the chemical health prevention specialist at Anoka-Hennepin Schools, says the rise of substance abuse is often associated with anxiety, loneliness, and other types of mental health issues.
I think when we get back to what we know to be normal, I think we're going to see an increase in the number of students that find themselves addicted to some sort of substance that they normally may not have.
As a safety net, the school district recently partnered with the Hazelden Betty Ford Foundation, which has 17 locations, including Plymouth and Maple Grove.
We can meet with students individually, having that licensed professional clinical counselor being able to be with them to talk about their substance use.
Cindy Doth with Hazelden says roughly 47% of students nationwide are experiencing major depression.
Oftentimes, some of the initial signs might be the change in grades, change in attendance within the school setting. Parents might also identify different eating patterns.
Doth clarifies that while Hazelden has a treatment facility, they aren't at the schools to treat students. Instead, they're really there to offer support and resources.
In order for our students to be as successful as they can be, we need to make sure that we have things in place to support them in all areas.
Pafua Yang, CCX News.
Find more local news stories at ccxmedia.org and follow us on social media.